Hope you're doing well today. This week in our class we were talking about diabetes, and so I wanted to share with you a little bit of information about what I've learned. So basically when we're talking about diabetes, we're talking about the pancreas, what's going on with different blood sugar levels, and then insulin. And to give you a better maybe perspective on some of this, I wanted to show you a really quick picture of where the pancreas is located in the body. Let me move this so I can see. So right here, you can kind of tell that the pancreas is located actually just behind the stomach. And there are many different things coming out of the pancreas. The pancreas secretes different hormones, like I just mentioned, insulin is being one of them, and also different digestive enzymes that help with the digestion process. So we're talking about diabetes, and we're talking about, like I said, pancreas, blood sugar levels, and insulin. And insulin is actually a hormone that's released from the pancreas, and that's there and where different things are going wrong and causing diabetes. So one of the things that happens is you get insulin resistance. So glucose doesn't enter the cells like it should. Basically, if you want to think of it this way, insulin takes glucose's hand and brings it into the cells. Without insulin, or enough insulin in the body, or if the body's resistant to the insulin, you're not getting the sugar out of the blood and putting it into the cells, thus the high blood sugar levels that we see in people. So insulin resistance is one of those things. Decreased insulin secretion by the beta cells in the pancreas, so we're actually not producing enough insulin that we should be producing. And then actually the body kind of counteracting or not really helping out by the liver actually making extra glucose via different pathways like gluconeogenesis and breaking down stored sugars that we already have in the body. So we can talk about some things that cause diabetes, and one thing we can blame our genetics. So blame your parents always, right? Genetics is a thing of where a cause of diabetes. We could be talking about different types of obesity, so ectopic body fat, so body fat that's not really needed, so excess body fat that we're carrying around, and our diet, right? So if we're having high glucose, high sugar diets and high fat diets, those things could be leading up to it. Inactivity, so that kind of goes into the insulin resistance. These people aren't used to utilizing the insulin that their body's already secreting, and so they're just having all this extra blood sugar floating around. And then also the older you get, the more likely you are to develop diabetes. So we could also talk about some of the symptoms of diabetes. And so people with diabetes sometimes are said to have excessive thirst. They're always thirsty, frequently going to the restroom, and then also hunger. It might be kind of weird to think of that way, that they have these increased blood sugar levels, but why are they hungry? And that goes back to the idea that sugar is never really entering their cells to satisfy their body, telling them that they've actually had enough to eat and that they shouldn't really be hungry anymore. So there are two main ways to actually test for diabetes and get a clinical diagnosis, and one of those is the fasting plasma glucose test. So that's basically where you fast overnight, you don't have any food, and then you wake up in the morning and they test your blood and test your sugar that way. If you're less than 100 milligrams per deciliter, then you're not considered diabetic. If you're anywhere between 100 and 125 milligrams per deciliter, you're considered to be pre-diabetic, and if it's anywhere greater than 125 milligrams per deciliter, you're said to have diabetes. And they confirm this diagnosis by running this test at least twice to give you that. So that's the fasting plasma glucose test. Then there's also the oral glucose tolerance test, and that's basically where you're also going to fast overnight or be in some sort of fasted state, and then you'll drink one kind of sitting 75 grams of glucose, so sugary drink. They can sometimes do blood draws every 30 minutes or just wait a full 2 hours and then test your blood sugar then. And they're looking for different ranges again. So if you're less than 140 milligrams per deciliter, you're not diabetic. If you're between 140 and 199 milligrams per deciliter, you're considered pre-diabetic. And then if you're greater than 199 milligrams per deciliter, you're considered diabetic at that point. So you might be thinking, who has a greater risk of getting diabetes? So I mentioned age earlier. So if you're older than 45, that's a risk factor. If you have a family history of diabetes, that's a risk factor, going back to that genetic component. If you had diabetes during pregnancy, that could be another risk factor. If you're low activity levels, these are all just a few to name a few. There's a large list. Diabetes is a really complicated disease that people end up having. And some fun facts I wanted to share with you. You said you liked hearing these, that actually, according to the CDC, diabetes and the complications from diabetes are actually the #1 leading cause of death in the United States. And some of those other things we've kind of already talked about with you, Grandma, is the idea of coronary heart disease, stroke, and actually hypertension are all complications of diabetes, and people dying of those things. Overall risk of death of diabetes is actually 2 times greater than someone who doesn't have diabetes. So you're twice as likely to die just if you have diabetes from all these other complications that can happen as well. And then the number of diabetics that are living currently. So in 2010, there were 285 million people actually were living with diabetes. And the forecast is that by 2030, I believe it's that around 430 million people actually have diabetes. So that number is kind of skyrocketing, probably exponentially. So I hope this was some good information to you, Grandma, about diabetes. Take care. Bye.